You know how incredibly frustrating it is to feel absolutely drained, completely out of sorts, but when you go to the doctor, they just tell you your tests look normal? It's maddening, right? You know your body better than anyone, and you just know something is off. Today, we're tackling a massive phenomenon that's honestly sweeping the globe right now. We're going to ask one really fundamental question. Why is the human immune system, this miraculous, highly sophisticated defense force that's literally built to keep us alive, suddenly acting like a confused army, turning its weapons on the exact body it's supposed to protect?
Welcome to The Explainer. I'm so thrilled you're joining me today because we are unpacking some truly fascinating work from Professor Ahmed Staten. He's a specialist in pediatrics, genetics, and nutrition, and we're looking at his research that we can basically call the Atlas of Autoimmunity. It maps out exactly where these conditions come from and, more importantly, how we can approach holistic recovery. Oh, and right out of the gate, there's a vital piece of data from Professor Staten's work we have to mention. This whole epidemic of immune confusion is disproportionately affecting women.
Okay, let's dive right into this. Here is our roadmap for today. First, we're looking at the autoimmune epidemic. Then, the multiple symptoms in diseases. Third, hidden triggers like diet and stress. Fourth, toxins and viral infections. And finally, we'll cover the functional medicine approach.
So, Part 1. The autoimmune epidemic. Let's be clear. What we're witnessing today is not just a collection of rare, isolated medical anomalies. We are looking at a widespread, rapidly growing health crisis.
So what exactly is autoimmunity? The crucial point from Professor Staten is that it's a condition where a genetic predisposition crashes into environmental triggers. When those two elements collide, they seriously agitate your immune system. Your body gets totally confused and starts producing antibodies that mistakenly attack your own healthy tissues. It's essentially the biological equivalent of friendly fire, and it leads directly to tissue damage and disease.
Moving on to Part 2, multiple symptoms and diseases, or the aftermath of that friendly fire. One of the most maddening things about autoimmune issues is how broad and incredibly vague they can be for traditional doctors to pin down. You might be all too familiar with some of these. Chronic fatigue, where you're just utterly exhausted all the time. Brain fog and memory loss. Depression. Unexplained physical pain. Or psychological distress. Professor Staten points out that the autoimmune spectrum covers over 100 different symptoms and diseases. Sometimes the diagnosis is super clear, but very often it's totally vague, leaving patients suffering through these seemingly random, erratic issues. But here's the thing. These vague symptoms are usually just the invisible tip of the autoimmune iceberg. Now, what's really striking about the whole picture is the sheer volume and variety of diseases that all stem from this exact same root problem of immune confusion. We see single-organ attacks, like Hashimoto's and Graves' disease, just ravaging the thyroid. We've got rheumatoid conditions and fibromyalgia going after the joints and muscles, or psoriasis and vitiligo impacting the skin. But it goes way deeper than that. The research highlights that autoimmune reactions can attack the nervous system too, manifesting as multiple sclerosis, Parkinson's, and even dementia and Alzheimer's. Some experts even consider certain psychological conditions, like schizophrenia, to have an autoimmune link. Then you have digestive diseases like Crohn's and ulcerative colitis, plus massive systemic conditions like lupus, type 1 diabetes, and antiphospholipid syndrome, which can actually cause severe clotting and premature miscarriages. On the surface, they all look so different, but the core mechanism, that friendly fire, is exactly the same. That brings us to Section 3, hidden triggers like diet and stress. Let's look beneath the surface of that iceberg we talked about. If genetics load the gun, it's our environment and lifestyle that are pulling the trigger. Let's break down the first two core triggers. Step 1 is stress. Professor Staten notes that severe psychological and physical stress throws our vital hormones into absolute chaos. It totally tanks your cortisol levels, messes with your adrenaline, your thyroid hormones, and your insulin. Then Step 2 is diet. Unhealthy food choices can literally be devastating. Sensitivities to things like gluten or certain proteins like lectins and casein, which you find in plants and dairy, can destroy your stomach acid and just annihilate your gut microbiome. And that cascade leads to leaky gut syndrome, sugar and alcohol toxicity, insulin resistance, and a severe lack of the nutritional supplements and intestinal enzymes your body desperately needs. You're basically starving your body of its essential fuel while directly feeding the inflammation.
Next up, Section 4, toxins and viral infections. Because of course, it's not just about what we eat or how stressed we are, it's also about the external invaders that further confuse our internal defense systems.
The third major trigger is chronic toxicity. We are constantly bombarding our immune systems. Professor Staten outlines this massive list of everyday chemical exposures. We're talking heavy metals, smoking, hair dyes, environmental pollutants, recreational drugs, makeup, personal care products, cleaning chemicals, pesticides, and those persistent organic pollutants lurking in food additives. It's an absolute onslaught. And if that wasn't enough, step 4 brings in covert infections. Viral, bacterial, and parasitic infections can actually linger hidden in the body for ages, keeping your immune system trapped on high alert.
And those lingering infections lead us right back to the friendly fire effect, which is also known as molecular mimicry. Professor Seton uses a brilliant example to explain this. Take rheumatic fever, which can sometimes develop after a standard strep throat infection. Your immune system does its job and creates antibodies to fight off the streptococcus bacteria. But here is the tragic flaw. The tissues in our own bodies, like our heart valves or joints, actually look biologically very similar to that specific bacteria. So the immune system gets tricked. It creates antibodies against the infection, but those antibodies get confused and end up attacking the similar-looking, totally healthy human tissue.
Which leads us to our final part, Section 5, the functional medicine approach. I know all this can feel incredibly overwhelming, but we are pivoting now from those massive root causes to the very hopeful, precise solutions offered by functional medicine.
This brilliantly illustrates the crossroads we're at in how we treat these conditions. On one side, you have the standard approach. Professor Seton strongly warns against rushing into chronic, long-term treatments with immune-suppressing drugs and cortisone. Sure, they might be necessary in acute phases, but using them long-term simply masks the symptoms and brings on some incredibly serious side effects. On the other side, we have the functional medicine approach. This is all about meticulous, precise diagnosis. It requires comprehensive testing for all those hidden triggers we just talked about, the gut health, the heavy metals, the covert infections. Rather than just chemically shutting off your immune system, functional medicine applies highly targeted preventive and therapeutic measures to fix the actual root causes.
I absolutely love this quote from Professor Seton, and I want to read it to you directly because it's so powerful. He says, "The goal is to implement preventive and therapeutic procedures to stop the disease activity and prevent its progression." You guys, an autoimmune diagnosis is not some automatic life sentence of inevitable decline. No way. It is a loud, clear signal from your body. It's a call to action to halt the progression through holistic recovery, meticulous testing, and intentional lifestyle changes.
So, what does this all mean for you? That's our final question to consider today. Take a good look at your own lifestyle. What everyday environmental toxins, maybe it's your daily cleaning supplies or your go-to makeup, what chronic stressors or what specific dietary choices might be confusing your immune system right this very minute? The power to heal really does begin with identifying the triggers in your own environment. So take a look around, start asking some hard questions, and empower your body to do what it was always meant to do, protect you. Thank you so much for joining me for this explainer, and I highly encourage you to keep exploring these crucial connections in your own life.